Good morning, everyone. Welcome to B&M Care's Dementia Awareness webinar. My name is Angela Hunt, and I'm the Sales and Marketing Director for B&M Care Homes. And with me today to present the webinar next to me, here is our Director of Dementia Care, Caroline Inch.
Good morning.
A warm welcome to our existing families joining the webinar today, and also welcome to those of you out there who've been struggling with a recent diagnosis of dementia for a loved one and trying to find your way through accessing further information and support. B&M Cares have been operating care homes for 50 years now. We have 28 care homes in our portfolio and a new site under development in Milton Keynes. So we have got a lot of knowledge and experience of caring for older people and especially supporting people who live with dementia. We take the view that providers like us have a real responsibility to share our knowledge with our families as well as the wider community. So today's webinar is part of a series of discovery events that we deliver, which includes funding long-term care, the virtual dementia tour, and our new level 1 dementia awareness accredited training program. You can go back to our website and look at our events page for the upcoming dates. But let's move on to today's event. You will see we have your cameras turned off, your audio muted. If you have a question as we go along, please join it to the chat and we'll endeavour to get an answer back to you on email after the event, if that's okay. And we'll try and reach your questions that way. We are recording, so a copy of today's webinar will be sent to you within the next couple of days. So moving on to today. Caroline Inch has worked in the sector for 28 years. I know she doesn't look old enough.
Oh.
Starting her career in care homes, progressing to care home management, and then into senior operational and dementia leadership roles. Caroline has a first-class honours degree in Dementia Studies from the renowned Bradford University and now steers B&M Care's vision and innovation around the delivery of person-centred dementia care. As you will very soon see, she's very passionate about research, evidence-based dementia, and ensuring that all of our residents experience the very best well-being whilst in our care. Okay, so I'm going to hand you over to Caroline, who's going to take you through the webinar, and we're going to move to sharing a screen. So give us a couple of seconds for the technical stuff.
Thank you. Oh, yeah, you're right. I can't see that. Bear with
Just a second. There we go. So that is.
Bear with.
It says hide.
Oh,
I think we're sharing the wrong screen. Give us a few seconds because we're clearly professionals at this, aren't we? We shared the
had
wrong
laptop
one.
issues this morning, hence one
I
laptop.
know, one laptop. So we're just going to go to this version here, share, and then put it on slideshow. There we go. And we just need
There
the
you go.
show
Lovely.
presenter's
Ah,
view.
sorry about
There
that.
we go.
We're
All
here.
good.
So, yeah, welcome. Thank you for joining. So we take great pride in delivering our webinars and our social support events to you because so many people these days are touched by dementia, and we want you to go away having learnt or been helped in some way by the information that we give you today. Our dementia webinar is accredited, so if you are a professional and you want a certificate towards your CPD, we can do that. And if you pop us an email, we can get that sent out to you. So the aim of the webinar is for you to learn a little bit about dementia, how it can affect your loved ones, how to interpret behaviours of distress, which we can sometimes see in dementia, and to learn a little bit about the term person-centred care and how you can apply that to your loved ones at home. Also, at the end, Angela will conclude about how care homes can support you in your community and how to help you positively in your journey on dementia, whether you're living with dementia or you're a family member. So first and foremost, we always feel it's a little bit useful to give a bit of a brief overview of the most up-to-date dementia data, because Currently in the United Kingdom, we have over 950,000 people living with a dementia. 1 in 11 people over the age of 65 have dementia, and currently 19,000 people are living with young onset dementia. So, if you hear the term young onset or early onset, that is not in relation to the stages of dementia. That is a term that we use to identify somebody who is under the age of 65 years old. A powerful stat that we often talk about in our training is that 1 in 3 babies born today will go on to develop dementia. So, not to be doom and gloom, but this is a bit of a ticking time bomb, and more needs to be done to support. You're right. Sorry, Angela's coughing here. We'll let her do that in the corner. I'm going to give her a little bit of my water there. She can have that. Sorry about that. So way back in 2015, when David Cameron was the Prime Minister, he developed the Prime Minister's Challenge, and he said that by 2020 we would be the top country in the world for dementia care and research. Now we've got a long, long way to go, but it's providers like B&M Care and the Alzheimer's Society and the National Research for Dementia, all these other groups that really are paving the way for dementia care and research. So a lot more needs to be done from government, absolutely. The last National Dementia Strategy, Living Well with Dementia, was published in 2009, some 15 years ago, which is why we feel at B&M Care it's important to support people that are affected by dementia and guide them around dementia. So, reach out to your care homes, because that really is, what we're here for, and we are a source of knowledge. So, dementia is a condition that affects the brain, and dementia is an umbrella term to describe a number of symptoms to include issues with memory, communication, and language. There are over 100 different types of dementia, but the 4 most common types are Alzheimer's, vascular, Lewy body dementia, and frontal lobe dementia. These are the 4 main ones that we tend to see quite a lot within our care homes, in addition to younger people living with dementia as well. So, getting older and having memory relapses is very different to dementia. Losing your keys is normal. Holding your car keys in your hand and wondering what to do with them is not normal. We also find with old age that the language, finding the right word, is modestly affected by the aging process, and the speed of processing information does gradually slow. But this is normal aging, and this can start from around our mid-40s. Forgetting words and having them on the tip of your tongue, walking into the room and thinking, what am I doing here? I do that an awful lot. That is all very, very normal. And there are lots of things that can really impact our memory, such as, being under a lot of pressure or stress, poor diet, lack of exercise, certain deficiencies such as vitamin D, vitamin B, and iron, and also menopause as well. We also, in dementia care, use the term executive functioning, and this is the process of information in order to plan, make decisions, and solve problems. And what we find with dementia is that people may have difficulty with their executive functioning. And we often observe this with residents that are in our home, where they may get stuck on certain things like washing and dressing. Another example of impaired executive functioning in dementia can include poor judgment, disorganisation, disinhibition, or inappropriate behaviour. And we often hear residents being found maybe wandering the streets at night, or going out in the daytime in their sort of bedclothes and not wearing suitable clothes for bad weather, example. So dementia does impact in many different ways, and it's not just about memory loss. So we touched on this a minute ago. So there are lots of different risk factors of developing dementia, such as age, lifestyle, genetics, and they all play a part. And there are lots of things that we can do to prevent dementia, especially vascular dementia, and that is keeping a good healthy weight, a good BMI, eating, a balanced healthy diet, trying to reduce stress within yourself, and also keeping an eye on your blood pressure and your cholesterol, and taking regular exercise such as walking. A study in 2022 found that low blood levels of vitamin D were linked with a higher risk of dementia as well. And people can boost vitamin D's level from diet and supplements or sun exposure, but we're quite limited on that in our country. Um, and there are certain conditions that may also present like dementia, but with treatment they can be reversed. And again, that could be anemia, which also impacts memory and cognition. And these are all treatable. What we often see in our care homes is that people also have urine infections, or if they're feeling poorly, that can also bring about dementia-like symptoms and certain behaviours of distress. And once these are treated, people largely, tend to improve. So in this section, we take a little look at the brain. I like this. We deliver this on our level 2, and it just gives a bit of insight into how dementia affects the different parts of the brain. And I always find it useful to share with loved ones. In the whole term of person-centered care, we don't place a lot of emphasis on the clinical element of the disease. And person-centered care is more about looking at the psychosocial element and looking at people's well-being, their psychological well-being. But the biological element does have a very, very important part to play. And it's really important how dementia can affect certain parts of the brain. So the brain has 4 lobes of the cortex, and they all do things very, very differently, and dementia can affect them differently. So, for example, at the front, behind the eyes, controls emotions, what we say, what we do, our planning and our executive functioning, which we spoke about earlier on. Also, the temporal lobes at the side of your ears is the part of the brain that is all about knowledge, understanding, memory, language, and communication. It also controls our inhibition and mood. So if this part of the brain is damaged by a dementia, it can increase mood swings and disinhibition. So we see that a lot in our care homes, and maybe, it could impact people that are presenting with sexualized behaviors. And we do often see that as well in our care homes. The parietal lobe, if this is damaged, it affects the process of planning. It increases poor spatial awareness and bodily awareness, and it can also impact dexterity and motor skills. And this is important to know because it also can affect mobility, and then we see an increase in the risk of falls. It can also impact a diet, as if the residents may not be able to hold a knife and fork, they may not be able to eat enough food and keep up their nutritional value. And also, if they're trying to mobilize, they may bump into objects and bruise and cause an injury. And then at the back of the brain is the occipital lobe, which is all about visual perceptions. And the occipital lobe helps us make sense of what is coming through the eyes. And if there's damage to the occipital lobe, this will impact the way in which a person with dementia sees their world around them. It will impact how they interpret colours, how they interpret lines, how they interpret shapes. And we often find in dementia that the colour black, a black mat on the floor, can be perceived as a hole. Geometric shapes and patterns are no good for people living with dementia because it can bring about hallucinations, and they're unable to differentiate all the different lines and colours. So it's very, very important to consider your environment at home as well. What we have at B&M Care is our Wellbeing by Design guide, and that was developed in line with research and best practice. And we've really, researched all about the dementia environment and what works for people and what can support people. And that's looking at things like colour contrast, wayfinding, signage and artwork, and getting people outside within the elements, even if it is raining today, to feel the rain on your face or the wind in your hair is all about, bringing about well-being. So in this slide in particular, we look at notable behaviours and how they may present in dementia. And this is now thinking about sort of the psychological element of the person-centred care model. A loved one with dementia may exhibit a challenging behaviour. Now, we don't use that term because we don't look at it as though they're being challenging, and we often refer to them as behaviours of distress or a form of communication or an unmet need. People living with dementia may exhibit these behaviours because they're trying to tell you something, and they're trying to communicate, and they're trying to express to you how they feel. And most behaviours of distress may appear to be challenging, and that happens with a resident who or a person with dementia who's got an unmet need. When the person with dementia, your loved ones, your family member, or a resident may be feeling disempowered or losing an element of control, they will try and take back control. And sometimes we see this in care homes with residents that are refusing to bathe or wash. And this is so they can retain a sense of autonomy over their lives, feeling control of their lives. They're keeping hold of their dignity and their sense of self. They're telling you no. We also see a lack of focus where sometimes residents cannot sit still and they are walking with purpose, pacing, and you might hear the term sometimes wandering. Now, we often think if we see that in residents that they may be in pain. And how do we identify pain and discomfort if they can't tell you? So we have to look at certain behaviours of distress and take note. That's why it's very important to know the people we care for, and we rely heavily on families for life history, not just their medical history, but what shapes who they are. We often see as well the loss of peripheral vision. And if we don't communicate properly and effectively with someone, we can cause a bit of a high startled response, which can then lead to a resident hitting out and having anger or aggression because they are scared. I've had this myself many years ago when caring for a gentleman, and I just totally forgot, I just came behind him and asked if he was okay, and he couldn't see me, and he lashed out with his arm. And that wasn't his fault. It was the way in which I approached him. So approach and communication is absolutely important when caring for your loved one with dementia. We often see that there's a difficulty recognizing people, and this is often called facial agnosia. And this is reported quite a lot in Alzheimer's and attributed to the memory impairment. Now, that must provoke very, very many worries for the person living with dementia because they're unable to recognise their loved ones and they mistake loved ones for other people. We had this in one of our homes in Northamptonshire many years ago where a resident thought her son was her husband. So she would get a bit amorous and want some attention of her son. And then he really, really struggled with that. So we just kind of supported him through that journey. So, this also creates an increase in a behaviour that we call shadowing. And this is where residents with dementia are feeling frightened, they're feeling scared. So they will follow you around. And that's quite hard if you're at home and you're caring for your loved one and you've got, your spouse or your mum or your dad or your brother or your sister, kind of at the side of you, but it is because they're feeling vulnerable and feeling frightened. So we do take notice of these behaviours and look at what the person might experience and how they may express them. In addition to that, there are other reasons. Oh, hang on. How do I get that up? And yeah, oh, hang on, bear with me. Oh, there you go. It's all mod cons. There are other reasons for behaviours of distress. So if we go back again to the person-centred model, we don't look at, somebody has dementia and here is a diseased brain. We always try to rule out, the other reasons for the way in which people present. And as I touched on earlier on, pain and discomfort that is undetected is a big cause for changes in behaviours. Pain is one of the most common symptoms that people with dementia experience. However, often it is very poorly recognised and undertreated in dementia. And the main reason for this, as we know, is that as dementia progresses, your loved one's ability to communicate pain becomes more difficult, which is why we need to treat pain appropriately and, make sure it supports the resident. We have an app that we use in some of our homes. We're trialing the minute, which is an AI tool or a facial recognition app on a handset that can detect pain and discomfort in people with dementia. But if you know your loved ones and you know that they might hold their head if they're experiencing pain, or they might be rubbing their back, or they might be able to sit still, the first thing we should be doing is ruling and rule out pain and treat it effectively. Poor health can also contribute to behaviours in dementia, and this could be as a result, as I said, of an infection such as a UTI. And if your loved one has a sudden or unexplained change in their behaviour, such as increased confusion, agitation, apathy, withdrawal, this could be because of just feeling poorly, urine infection, chest infection, things like you wouldn't think about: sore gums, dentures, sore feet. So, it's always good to know the physical elements of your loved ones to be able to rule in and rule out pain. And then we come to low mood and depression, and they are another reason as well. As well as having, negative feelings, if a person with dementia has depression, it can make problems with their thinking and memory so much worse. Depression may also make changes in their behaviour worse as well. They may be agitated or a little bit more snappy, or a little bit aggressive. Again, we don't like using these terms, but you've got to think about the journey they're going on, the changes they're facing within their lives, and how vulnerable they feel, how scared they may feel, and how vulnerable and scared you may feel as well as family members and loved ones, because this is all new to you. So, the person may have depression due to the diagnosis and due to the loss of control that's going on around them. And then one thing that we also focus on is medication, and certain medications that we use can impact behaviours, and we don't tend to use a lot of these medications. They're called antipsychotic drugs or neuroleptics. But they do have a place, and I've seen wonderful, wonderful outcomes for people living with dementia who have been treated, in a mental health or psychiatric setting where they've had very good outcomes of the use of these medications. But they can, if misused, cause, sort of serious side effects, which does include daytime sleeping, drowsiness, confusion, and unsteadiness, and reduced mobility. So we always ensure that we work within a framework that promotes person-centered care. We always work within the nice, guidelines, and with our GPs and our mental health teams to make sure people are supported properly. One thing that we touched on a minute ago was about life history, and our lives shape who we are, and it can really, really help us as a care provider care for people if we know where they came from and their stories and who they are that shaped their life, because that helps us then shape the future of their care. And this is very important because it helps us as carers have better communication and understanding of a person's needs, which go on to provide, us the information to develop robust care planning for them. And one thing we have really focused on at B&M Care, and again, we can do that at home, is the environment. An over or under stimulating environment affects a person with dementia, and they're very, very sensitive to their environment. So we always say moderate levels of stimulation is best. When people experience overstimulation, it increases confusion, it increases agitation, and they may become restless. Whereas if there's not much going on around them, we see people sleeping inappropriately early in the morning, It could be that they withdraw and there's apathy and they lose their appetite and so forth. So having, the right environment for them, which is aligned to their life history, can make all the difference for somebody living with dementia. Um, so another thing we cover off in our webinar is the pathway to diagnosis and beyond. And a diagnosis can bring a mix of relief for some families and some people living with dementia, but also it can bring worry and grief. And these feelings are all normal and they deserve time and support to process. We often hear that families often feel isolated after a diagnosis and wonder, what path do I take? And when we've done these webinars, in person, this largely, and Angela will vouch, is the topic of conversation. What do we do now? If you or someone you care for is noticing memory changes or thinking that they don't feel something's right, the first and, most important step is always to speak to your GP. And the GP will sit with you, take a full medical history, and they will look at everything from your medication. They may carry out a brief cognitive screening. We call it a mini mental test. And they ask, set questions and structured questions. And they use that to look at your thinking, your memory, and your daily function. The mini mental test isn't a diagnostic tool, it's like a screening tool. And a GP may also run some bloods to rule out whether or not there's any treatable condition that we spoke about earlier today. From there, the GP may refer you to a memory clinic or an older people mental health clinic for more investigation. And it's there you would get the more detailed testing, scans if needed. And then if there is a diagnosis, they will likely talk about the type of dementia that you have. In addition to that, then you're kind of then prescribed maybe a medication, or they will signpost you, and then you'll be sent back to the care of your GP. However, we find with families there is a lot of like, where now? Where do we go? And that's why we feel, we're here to offer that support along with other organisations like the Alzheimer's Society and Dementia Friends. And we try to have dementia coffees and dementia community engagement events just to kind of bridge that gap between our care home and the community, because there is that lack of support or wayfinding really for people after they've got their diagnosis. So it's very important that people feel supported at a time when they're most isolated, really.
It really is a case of diagnosis and then kind of get on with it, isn't it? Get on with it yourself, which is why at B&M we're trying to bridge those gaps by offering some of these little proactive outreach sessions with these webinars and the virtual dementia tour training and the level one training as well. So our doors are open and we're here to listen and advise if you need that help.
Thank you. So what can you do to support your loved one? There are many things we can do to support our loved ones with dementia, and we have a few tips that we kind of implement in our home to share with you. So validating what people say, we use this cliche term, jump in their bubble. But it really is about that. What is real to someone with dementia in that here and now is real to them. So we often, we say to people, don't confront and don't correct them. And we use a technique called validation technique. So if somebody is asking, I want, where's my husband? What time is he coming home? We're not going to turn around and tell them that, well, actually, your husband passed away 3 years ago. So instead, we acknowledge that they're talking about their husband. So it might be, yes, Bill, didn't he have, lovely jet black hair? And do you remember that time when he done this or he done that? So you're acknowledging that they want to know about this person, but you're diverting the topic away from, where is my mum? Where is my dad? Where is my husband? And that's validation technique. And that's jumping in that bubble and going with their reality. We often hear stories about people that have said that, well, actually, a couple of PCSOs joined one of our webinar or seminars some time back, and they had a call to a lady who was convinced there was children in the tree and there was a man in the draining board with a gun. But they were wonderful, and they got the man from the draining board out. So they totally immersed themselves into their reality, into their moment when they were having possibly an hallucination, and they supported them through that, which is what we have to try and do. Another thing which is really important is to take time out for yourself because you are going on this journey with them. And we cannot forget about you, the carers, who are, if not the most important people, because you have to hold everything together. And we always say that join a group, join a network, join a local dementia support group, come into our care homes, come and have a cup of tea, because it really is quite, a lonely journey sometimes for you. And our care homes are these hubs in the community, not just B&M. There's like over 5,000 across the whole of the United Kingdom care providers. So there's a wealth of knowledge there to be shared and support for people, for you to come and, yeah, just offload and just relax and be calm. So if you don't have that connection, we're always there. In addition to that, we thought we'd end my little section before I pass on to Angela about the B&M Rose model. So we developed the Rose model back in 2018. As Angela said, 50 years of delivering dementia care is a long, long time. And we're very fortunate, we're a family-run company. Everyone has, the wonderful values. People are committed, they're compassionate, they're connected, and the whole of the Rose model is underpinned by these values. And it is about being person-centered and looking at the individual and making sure that every element of our petal is incorporated into a person's daily life. We also look at well-being. Well-being is how we measure our care. How are people living well with dementia? And we do use a lot of research in that, and we use dementia mapping, which was founded by the Professor late Tom Kitwood. And this really does help us measure the level of engagements and quality of life of people living in our care homes. So, we do care a lot about dementia, and we hope we found this very, condensed or, webinar useful. And Angela, I'll hand over to her, but she has an update on all the other support sessions we have.
Just moving back along the bench to move
leave
into. No, you can stay there.
Okay.
We'll sit side by side. So, thank you, Caroline. As you can see, we feel it's our obligation to support the communities in which we operate homes. We know a lot about older people, specifically about dementia. So these are some of the ways in which we might be able to help. And if we can't help at a B&M home, that you might be able to access some of these resources within your community or in another care facility as well. So you can look out and join memory cafes. Look at your local care home as a place to come to for advice in terms of respite and recuperation and covering those holiday breaks for carers. Group and family support, so coffee mornings, and memory cafes we've already talked about. It's an opportunity to network with each other as well, signposting onto other organisations and other support groups. I'm going to talk to you in a second about our funding webinars, because that is a huge worry, just the ongoing cost of care. Our virtual dementia tours and our level 1 dementia awareness training. Let me just tell you briefly about what they are. So the virtual dementia tour is actually in person, not virtual. But it does give you an unprecedented insight into understanding the world of dementia. It's an interactive training experience that all B&M staff go through, and we do offer this out to our families and the wider community. It is a great insight, and it's a very
Mm.
powerful piece of training. So we make that available for it within our communities. If you hook back onto our website, you'll see the dates. But at the moment, we've got two confirmed locations for those in February and May. Follow the same process as you did before to book onto here. Visit the website page, and you can hook up to those dates. The next event we organise is it's kind of an in-person version of what you're sat through today. But what we're able to do is offer that in a deeper level, and it is accredited. So you will be able to get accredited CPD from Advantage Training from that. So it is a much deeper insight into that. The dates for those two courses, we run that twice in the year. That's the 28th of April coming up and the
Yeah.
20th of October. That's delivered by our head of training, Elaine Thorpe, as well, who will join you on that day. So just really to summarise today, you can see it's Caroline's passion, it's our passion. We're very good at delivering good dementia care. So come and spend some time with us at one of our other community events. Sign up for the awareness training or have a go on one of the virtual dementia tours. Take a tour around one of our homes if you've not had the opportunity to do that. Um, Following today, we will be sharing we have recorded today's events, and after we finish today, I'll be sharing a little feedback form with you. So if you complete that for us, I will respond to that and send you your a copy of the recording, and you can let us know if you would like to receive a CPD certificate. Other than that, please do follow us on our social media channels, which will really give you an insight into how well we do dementia care and our offering at our homes. So they're all the channels you can reach us on if you have any general inquiries. I've popped my email address on there and Caroline's as well. So if you've got those specific questions that you want to address to us about something more
Anything.
personal, your personal journeys, we're happy to tackle them for you and come back. Other than that, we
Yeah.
are pretty much done. Thank you very much for your time and attention today. So, as I say, we'll be asking you to complete a little feedback form, and we'll send you a copy of the webinar today. So, thank you very much for attending. We will sign off and
Yeah.
say goodbye.
Bye-bye.
Goodbye from me.
Bye-bye. Goodbye
Goodbye.
from me.
Thanks a lot. Thank you.
Bye.
Bye bye. Just
Oh, I too. I need to get a break. Yes. Oh, bless.
You're welcome. Goodbye, everyone.